Hello, good morning, colleagues. Thank you for this opportunity to participate at this forum. I am Dr. Tracey Bovell, an emergency medicine specialist with a focus on trauma and mass casualty. Now, today I am tasked as the Trauma Team Training Coordinator to present on Trauma Team Training in Guyana. This is a map of Guyana. And in bringing things into perspective, it's important to note that Guyana is a third world developing country. It's located on the northeastern part of South America. We share borders with Suriname, Brazil, Venezuela, and with the Atlantic Ocean in the north. Now, my beautiful land of Guyana is also known as the land of many waters. And if you look at the map, you'll see a lot of blue lines in it. And those blue lines represent rivers. Now, Guyana's terrain comprises of rolling highlands. It comprises of low coastal plain as well. And we also have savannas in the south. Now, all of this land is actually divided into 10 administrative regions. Now, traveling across Guyana varies depending on the administrative region. And this map here shows you the locations of the 10 administrative regions. The only tertiary institution in the public system is located in the capital, Georgetown. So most patients were always referred to the Georgetown Public Hospital Corporation from all of the 10 administrative regions. Now, after looking at this situation thoroughly, the need obviously was there to ensure that patients were stabilized and treated appropriately, and that procedures that were done the way they should have been done and followed through. Now, my colleagues, after they looked at the gap and they realized the urgent need in the communities, they decided that we can have our very first trauma team training in Guyana. And that very first trauma team training in Guyana happened in October 2006. Now, this was a big deal. And it all came together thanks to the Canadian Network of International Surgery, who at the time was supporting the Canadian Association of General Surgeons project in Guyana. This course was developed and delivered to persons from different regions, in that way ensuring that the knowledge that they gained from the training, including the skills learned, were not just limited to the central locations, not just limited to Georgetown, the capital, but we were going to ensure in that way that the same caliber, the same quality was across the 10 administrative regions, that the skills were done appropriately throughout the length and breadth of Guyana. Now this here created a great boost in the trauma care system in Guyana. Over a period of time and follow up on the persons who were trained over the initial 4-year period, an evaluation was done of the course, and it concluded that retention of knowledge and simple skills were pretty good after 4 months, but there was an obvious deterioration in performance of complex skills. And so there was a perceived need for a refresher course and an opportunity to include high fidelity simulations. So a trauma team training update course was held on November 14, 2010. And this allowed the persons who, yes, you were trained before, but you did not remember everything because of lack of practice. You were able to refresh that knowledge and refresh your skills, and maybe come with other questions that you had developed throughout those 4 years of your practice. From 2014 to 2018, there was no trauma team training. However, please note, we still had trauma in Guyana, and we still had traumatic patients to treat. It was our needs for training of personnel that actually pushed us to ensure that in last year, 2019, we restarted trauma team training. In 2019, an agreement was signed between the Georgetown Public Hospital Corporation and the Canadian Network of International Surgery. As of July 2019, we have trained 23 instructors and 4-to-1 providers. Now, our plan was always to have a course every quarter. So we would end up having 4 courses per year, at least 4 courses per year. With that aim, we had a scheduled course in 2020, this year, March. And that was postponed because due to the curfew and the increased need of staff during COVID-19 pandemic, that had to be rescheduled. So at the moment, what we're doing is having discussions as into our way forward for training, not just only during COVID-19 period, but after the COVID-19 period. I want to say thank you so much for this opportunity once again. And I invite you to come to Guyana and bask in the beauty of Guyana, my beautiful country. Thank you. Bye.